Greetings of the day, dear students. Today we will learn about common postural deformities and their corrective measures. Posture. Posture is defined as the attitude assumed by the body either with support during the course of muscular activity or as a result of coordinated action performed by a group of muscles working to maintain the stability. And it is important to ensure maintaining a good posture. This is possible where all body parts are aligned in such a way that at least stress is put on the joints and muscles, and thus it helps to prevent fatigue. So here there are some costs if we do not maintain a proper posture or a good posture, then there are chances of some postural deformities. So, postural deformities are abnormal alignments of the body that deviate from the normal posture. And the causes of postural deformities may be by heredity, by diseases, injury, poor habits, improper clothing, unhygienic living conditions, improper diet, improper exercise, obesity, socioeconomic conditions, lack of nutrition, and weak muscles. Today, we will talk about postural deformities like knock knees, flat foot, bow legs. These are some deformities of legs, and deformities of spines such as kyphosis, lordosis, scoliosis, and round shoulder. We will talk about leg deformities. First, here is knock knees. So, knock knees, also known as genu valgum, it is a knee misalignment that turns the knee inwards. As a result, both knees touch or knock against each other in a normal standing posture, like it's shown in the figure. And it is generally noticed in the early childhood. It usually corrects itself naturally by the time the children are 7 to 8 years old, but in some cases it continues till adolescence. The main reason or main causes of knock knees are it can be due to injury, infection in the knee, rickets, severe lack of vitamin D, calcium, obesity, or arthritis in the knee. And the corrective measures to correct this deformity are sideward walking with pillow or sleeping with taking pillow in between the legs, horse riding, uses of corrective braces, and all those exercises in which our knee is apart. We can also perform some asanas like Padmasan and Gomukhasan. These asanas are very helpful to correct this deformity. Now, next deformity is bow legs. So, bow legs is also a deformity of legs in which there is a gap in between both knees. It is also known as genuvarum and is a position of knees in which legs look like a bow, as shown in the figure. When the leg curved outward at the knee while the feet and ankle touch. It's more often seen in infants and toddlers, and it can be caused or it may be caused due to lack of vitamin D, calcium, lack of phosphorus, and it can be cured easily in early ages of development. And the corrective measures for bow legs are proper stretching of inner thigh muscles, taking proper nutrition, yoga poses like Tadasana, then use of orthotics in the early age, performing Garudasana, Ardhamastendrasana, and also walking while on inward toes will also help to correct the bow leg deformity. Then we will next deformity is flat foot, also known as pes planus. It is deformity of our toe. Arc is missing in this deformity. It is a condition that may be diagnosed by looking at the arc of foot or by taking the water print test. And in this deformity, there can be no arc in the feet or very low arc, allowing the entire soles of the foot to touch the floor in standing position. It can be genetic, it can be environmental, and it may occur due to long standing or wearing improper shoes, wearing high heels or tight shoes or very heavy shoes. Then it may also occur due to carrying heavy weights for long duration of time, by arthritis, etc. Then the corrective measures of flat foot are toe curls, towel scrunching, walking on toes and out edges, wearing arch support shoes or footwears, walking, standing, or jumping on toes, then skipping rope on toes, and activities like picking up marble with toes, writing numbers in the sand with the toes, curling the towel, and performing some yoga asanas like Adhonmukh Svanasana, Vajrasana, or Tadasana. They can also help to recover from this flat foot. So here we talked about leg deformities. Now comes spine deformities. So in spine deformities, all the deformities related to our spine, or the we can say curve of spine, are known as spinal deformities. We will talk about first kyphosis, also known as hunchback. Kyphosis means there is an increase in the backward curve of the spine or lessening of the forward curve. leading to a rounded back. We can say a sunken chest is often seen in kyphosis. The main causes of kyphosis are not enough exercise or weakening of muscles, poor nutrition, carrying heavy loads, long, we can say long table work. So these are the some causes. Now, corrective exercises are back extension exercises, wall slides, head retraction exercises, thoracic spine form rolling, strengthening upper back muscles, and some yoga asanas like Bhujangasana, Chakrasana, Adhon Mukshwanasana, Dhanurasana, etc. Now, next deformity is lordosis, also known as hollow back or sway back. In this lordosis, there is exaggerated inward curve of the spine, usually in the lower back or we can say lumbar region. This curvature can make standing or walking uncomfortable, and it can make someone feel stiff, self-conscious, and less confident. The causes of lordosis are unbalanced diet, unhealthy environment, weak muscles, obesity, and conditions that affect the spine and back muscles, not enough exercising, overeating, or obesity. The corrective measures to correct this deformity are by doing hamstring and hip flexor stretching, by doing pelvic tilt exercises, by making core strengthen, by doing some abdominal strengthening exercises, by performing some yoga asanas like halasana and paschimottanasana. Next deformity is scoliosis. Scoliosis is a condition where the spine curves to the side. When viewed from behind, it looks like C or S shape. The curves can be known as right convexity if they bend to the right, or left convexity if they bend to the left. Causes of scoliosis are like joint or bone diseases, leg growth issues, polio, rickets, carrying heavy loads on one shoulder, poor environmental conditions like bad lighting, inappropriate desk, partial deafness, and incorrect standing habits. It can also be due to inborn or developed spine, muscles, or nerve issues. The corrective measures of scoliosis are by performing slow cardio exercises, horizontal bar hang, bending exercises, spine molding, static chest stretch, scoliosis specific physiotherapy, by bracing, and by performing yoga asanas like trikonasana, we can say marjari asana or cat or cow pose. Our next deformity is round shoulders. Round shoulder is a condition where the shoulder appears rounded and sometimes seems to lean forward. It it can occur because of bad posture, like slouching while sitting, standing or walking, then wearing clothes that are too tight, using furniture that doesn't support good posture, weakening of muscles, and getting used to pushing the chest forward. And the corrective measures for round shoulders are doing the practice, yeah, practicing shoulder blade squeezes, doorway stretches, hanging on horizontal bar or rod to stretch out the shoulders, then performing some asanas like chakrasana, dhanurasana. So here is a summary table for the deformities. Here, like for knock knees, the main causes are weakening of thigh muscle. To correct the knock knees, we can perform pillow exercises, padmasana. Bow legs causes can are congenital or rickets. Then stretching exercises and performing Garudasana, Ardhamasendrasana can help to correct bow legs. Next deformity is flat foot. The causes are obviously muscle weakness, and the corrective measures are toe curls and using arch support, shoes or slippers, sandals, and then performing Tadasana. Next deformity is kyphosis. Main reason is poor posture, and corrective measures are doing back extension, stretching and exercises, performing dhanurasana, chakrasana, bhujangasana. Next deformity is lordosis. It is because of weakening of core muscles and pelvic tilts, strengthening of core, and performing halasana, ardhalasana is helpful in treating the lordosis. Scoliosis. The causes of scoliosis are spinal asymmetry, and the corrective measures are bracing and performing trikonasana, hanging on a bar. In round shoulders are because of bad posture or bad habits. Then corrective measures are hanging on horizontal bar, performing chakrasana, dhanurasana, and there are so many. So, what is the importance of early detection? In early childhood, if we came to know about these deformities, then it prevents us from long-term complications. It enhances mobility and confidence. It promotes good posture and muscle balance, and obviously the efficiency in movements or our activities. So these were the posture deformities and their corrective measures. Thank you all.